Hi, I'm Dr. Joel Cherdak, president of Houston Regenerative Medicine. One of the stem cell procedures that we perform that's somewhat unique to our clinic, because very few regenerative medicine clinics in the country are able to perform this procedure, is stem cell therapy to treat degenerative arthritis and disc injuries of the neck. Now, people suffering from this condition, particularly if it's degenerative arthritis, it'll be a slow onset. They'll start feeling pain over time. If it's a disc injury, oftentimes it's an immediate onset, and people will feel sharp pain and maybe nerve pain shooting down their arm, and perhaps some tingling or weakness. What most patients will do in that case is they'll take over-the-counter pain medication, see if it heals on its own. When that doesn't work, they might go to the physical therapist or the chiropractor, where they may get improvement, and that may solve the problem over time. Physical therapy is another option that patients often choose to treat these types of injuries. The problem is when you get to a point where you're no longer improving, or if you're actually getting worse, the pain can be so intolerable that patients have a hard time sleeping, a hard time focusing. It really has a major impact on the quality of life in patients that are suffering from either degenerative arthritis of the neck or a disc herniation or bulge in the neck. So, like I said, if the physical therapy or the chiropractic or whatever conservative therapies people are choosing don't work, or a patient's plateaued, then oftentimes the next option that they choose is to get steroid injections. These injections are typically done by a physiatrist or a physical medicine doctor who's an MD that specializes in using injections to treat pain. Oftentimes these steroid injections will be very helpful, and they may work for 6 months or longer on the initial treatment. But unfortunately, once they wear off, you have to redo them again. And each time you have another set of injections, the time that it lasts keeps diminishing over time. Now, patients in this scenario oftentimes will progress to surgery, where it can be a surgery to either remove part of the disc, which is called a discectomy, or it may be a full fusion surgery where they either put in an artificial disc or remove the discs and fuse the bones together with a bone graft and a plate in front. And that obviously doesn't sound very fun, and the end result is never going to be perfect, because you're going to lose range of motion no matter what, because of scar tissue, or if you have an actual fusion, obviously that's going to really reduce your range of motion. So let me show you on the model what we're talking about. So this is going to be looking at your neck from the side. These are the discs between the bones that you have in your neck. These joints in the back, where the vertebrae connect together, where the vertebrae are connected, those joints are called facet joints. And here you can see the discs of the back. So you've got C1, C2, C3, C4, C5, C6, and C7, and that makes up your cervical spine or your disc. Now what happens is oftentimes in C6, C7, or C7, C8, you're going to get the most common, that's the area where you most commonly are going to see degeneration or a disc herniation that can push into the nerve and put pressure on the nerves that come out of the neck. With injections, with typical steroid injections, they can do one of three things, or a combination. They can inject the facet joints in the back if the degeneration is so bad that that's where the pain's coming from. They can also inject it into what's called the foramen, or the holes where the nerves come out. It's called a transforaminal injection. They inject the steroid across the foramen, and it'll relieve inflammation there. Lastly, you can also have an epidural injection, where they inject directly into the spinal canal, and with the idea that that steroid will go up the spinal canal and out the foramen and treat and relieve inflammation in that whole area. And over time, if we're talking about a disc herniation or a disc bulge, that will resorb back into the spine and hopefully relieve the problem. And so it does work for a lot of patients. Like I said, unfortunately, it's often a temporary solution, and those repeated injections not only lose their efficacy over time, but they can also degrade the tissue and create some spinal weakness. So we try to avoid that when we can. So where Stem cell therapy is really a better choice, is in the fact that the stem cells not only relieve the inflammation, but also set the cells of the spine and the tissue of the spine up so that those cells are going to create new tissue and grow new disc tissue or grow tissue in the areas that have been damaged by the chronic inflammation, which is the source of the pain. So not only are you going to get a relief from the decrease in inflammation, but your body's going to be set up to regrow the damaged tissue to provide a more permanent solution. So the way that we perform this procedure, we may use a patient's own stem cells that we derive from a small bone marrow extraction from the back of the hip. I've described this in detail in other videos on this channel if you want to know exactly how that's done and why that's a pain-free procedure. We also have the ability to use donor or umbilical cord-derived stem cells if we think that's going to be a better option for the patient, or a combination of both of those. In addition to that, we also oftentimes add exosomes, which are signaling molecules, which are derived from the stem cells. It's just not the full stem cell itself, but this will provide a more immediate reduction in inflammation, so patients will feel the effects of the improvement sooner than just the stem cells alone. And with all of our stem cell procedures, we always add PRP, or platelet-rich plasma, which we derive from a small blood draw and a centrifugation of that blood and extract just the platelets out of that, which acts, to explain it simply, it's basically fertilizer for the stem cells. And so if you're suffering from any of these conditions, degenerative arthritis of the neck or a disc herniation of the neck, even if it's pinching on the nerve, even if you've been told that surgery is your only option, we may be able to help you. If you want to find out more information about this procedure, click on the link on the bottom of the description of this video. It'll take you to our homepage where you can fill out a request for a free consultation. Our patient coordinators will be happy to answer all of your questions, and if we need to order any imaging, we will do that for you. Also, if you have imaging that's recent, we can look at that as well and tell you what we think the outcome will be. Now, what we try to do is under-promise and over-deliver in every case so that we make sure that the patient is getting the best possible care that we can provide. And if it's not the right solution for you and your condition, we'll let you know. We look forward to hearing from you. Thank you very much.